We're going to be going through the manual muscle test for coracobrachialis. So I have my individual in a seated position, starting with their arm kind of at their side. Now, a good way to think about this, as I just kind of mentioned in the palpation aspect, is that I'm going to want them to bring their elbow up and in front of their eyes. Okay? So some people kind of make this look like an uppercut kind of punching motion, but what's important is that the humerus does not rotate. So we don't want them going to this, which looks more like anterior deltoids fibers. We want it to come straight up with that elbow, basically in front of their vision. Okay, and then stabilize on top of your shoulder. Whenever you're ready, can you do that action for me? Great. So for the break test, I'm going to bring him approximately halfway through. Again, there's no action on the forearm, so I'm going to be resisting on his arm and holding on his shoulder. And it's helpful to be past that midway point as I try to bring his arm back down to his side. 5, 4, 3, 2, and 1. Good. Now starting with your arm at your side, you can again bring your elbow out in front of your vision, all the way up. Okay, great. So that was the active break and concentric components for coracobrachialis, concluding the manual muscle test. The last part for coracobrachialis is to show its length. So because of its flexion and adduction component, we're going to be taking the arm into extension and abduction. So this looks a little bit interesting, but you can either have your grip on the forearm as long as you're not really including the elbow, or you can go completely just on the humerus. I like to start on the forearm here as I'm going to bring his arm back into extension and a little bit into abduction while my other hand is stabilizing his shoulder. Again, there was no rotational component to coracobrachialis, so you don't want the arm coming out like this or turning in like this. You're just going to bring it kind of straight back towards you into extension, a little bit of abduction. So that would be the length position for coracobrachialis, which concludes all of our items.